Yes, so we can see from the surface we've implemented this piece of technology, and we've got something that works at the point of care. We're implementing the AI system, but there are clinical and administrative benefits that you don't necessarily see if you just consider, yes, we've got PainChek, yes, we're using that. And you can see some of them listed here, all of which are true and powerful in and of themselves. In isolation, they would all bring some power to this story. We did a sample study for one of our homes that was PainChek was implemented in. We've been collecting data around that for around 12 months now. And from that, I can sort of evidence that we've most certainly seen a significant increase in pain assessments. There's no denying it. The frequency and the quality has improved immeasurably. That then, of course, has led to more effective use of pain relief. We can see that from the data. Anecdotally, and I say anecdotally in the strongest sense of the term, mindsets of staff have changed when they are considering the causes of distress. It's there, it's right there for them, and so they consider it as a first port of call. Why is this person experiencing this difficult moment in time? Are they in pain? And you can see that run through their care notes. I've considered whether or not they're in pain, and even to rule pain in or rule pain out, because it's as helpful in that process as it is to identify pain, is to be able to say, look, the likelihood is that this individual is not experiencing pain. We move on to look for another cause. So from the sample study that we've done, we can see a month-on-month decrease in distress responses. We can track that through our electronic care planning system, so we can pull that data together. We've seen an increase in meaningful engagement, so people becoming engaged in day-to-day life, occupying themselves with what's important to them. However that looks, it's different for every single individual. Some of the most powerful data that we've taken away from this is around the use of psychotropic medication. I'll give you a couple of statistics on that. So benzodiazepine use in that 12-month period, and I said the PainChek is one part of the work that we're doing in terms of distress and reduction in distress and increasing meaningful engagement. Benzodiazepine reduction, we've seen 29% of that, of the residents included in that sample set have a dose reduced, and we've seen 46% have a benzodiazepine prescription stopped. Okay, antipsychotics, a real focus. It's recognised that these things are overprescribed and overused in dementia care. From the sample that we were monitoring, we saw a 29% of people having a dose reduced, and 33% dose reduced, and a 25% of people having an antipsychotic prescription stopped altogether. It's pretty powerful stuff. We consider what those things do to people. They increase their risk of stroke, they shorten their life expectancy, they reduce their ability to engage, they reduce their ability to mobilize safely, etc. It impacts on every area of their life. So to say that we've been able to achieve those figures is quite something. As a result of all of that, not only have we got residents that are experiencing distress, sometimes that distress causes things we need to report to the safeguarding teams. Okay, so that distress may be between two residents, there may be some conflict. We need to report those on to the safeguarding team. So we've monitored behaviour related safeguarding reports. And across that sample set, we saw a 92% reduction in incidents that we needed to report to the safeguarding teams. And of course, well, if that's not powerful enough, what we're doing with all of this is building much stronger relationships with our external partners. And as we've all alluded to across this session here, that is really key and fundamental. We don't need to sit on our own as care homes. We need to be part of health and social care and integrated into that. So to be able to build those stronger foundations and relationships, information sharing, knowledge sharing, and building respectful relationships is really important. So yeah, those are our outcomes up to now.